それでは
We'd like to start the second roundtable discussion. The theme is about the risk communication. We'd like to introduce the presenter and also the chair. The first chair is the Dr. Mikihito Tanaka, Faculty of the Political Science and Economics of Waseda University. And another chair is Ken Osaka, Tohoku University Graduate School of Dentistry. And the first presenter is Kaori Muto from Institute of Medical Science at University of Tokyo. And the second speaker is going to be Yumiko Nara, the Open University of Japan. And the third presenter is going to be Shuichi Kojima, Tohoku Medical and Pharmaceutical University. Please refer to the slide for the biography of the presenters. And Dr. Tanaka and Dr. Kosaka, please facilitate the session. Thank you very much for your introduction. The risk communication is the theme for the Roundtable②. And risk communication, that they are the one who struggle in the risk communication. And we would like to ask Dr. Muto, Professor Nara, and also the Professor Kojima to speak about the risk communication. So we would like to start with the Professor Muto. So Professor Muto, please start your presentation. Good afternoon, everyone. Thank you very much for your introduction. I am Kaori Muto, and I majored the art and science. However, I wanted to involve in the innovative medicine. I am the research of the ethical and also the clinical research topics and COVID-19 pandemic. And I was involved in the policy making of the government and crisis communication. Well, in other words, the risk communication, and I have experienced the risk communication and also the crisis communication. So I'd like to talk based on my experiences. So here in this session, I'd like to talk about the risk communication. What is risk communication? Risk communication is defined as activity aimed at sharing risk information and perspective through the exchange of information and opinions among individuals, institutions, and groups. And there are many definitions, but this is the very easy to understand the definition that I like. And the WHO guidelines 2028, before the COVID-19 pandemic, WHO issued a guideline for risk communication crisis. And as a real-time it defines the risk communication as a real-time exchange of information, advice, opinion between expert, government, and people facing various risks. Hazard, threat. The goal, it states, is to enable all people at risk to make informed decisions and take proactive and preventive actions to mitigate impact of threat such as a disease outbreak. So there are many classifications, however. And this was a consigned project by government, and I showed the manual. And risk communication, crisis communication. And I think the various definition of risk communication, they can probably be divided in categories, one based on timing and the other on function. And I now want to talk about the risk communication in early stages of pandemic, looking back on my experience with COVID-19. And based on timing, together with the government expert, and at the beginning, and I wrote the opinions, and that was communicated by the expert committee convened by the government. And this was the initial opinion expressed dated February 24. And it is very difficult. We are fighting with the diseases. Its complete containment is very challenging. However, to contain the speed of the spread of the disease is possible. To do that, 1 week or 2 weeks is going to be very critical if the virus will spread rapidly or to be contained. About this opinion, and there was the media coverage, and on the verge of the words that they have picked up. And when we issued a statement, and we have consulted with the government officials, and Dr. Wakita negotiated with the government officials to issue this statement from the expert. And the government strongly discouraged this statement, saying it was too strong. However, they were adamant that measures needed to be started immediately, and we cannot compromise. That's why we have negotiated with the government. So we have to think about the worst case, and to prevent the worst case, what can we do? And that is what the statement says. And in this opinion, currently, it talked about the action that can be taken by general public, and as a characteristic of the speed, a characteristic of the infection, and it is the close contact between people with the outreach of arm and in conversation more than 1 hour, and the situation that people were exposed to, the close contact. So this is a concept of the social distance, about how we distance with the other people. And the expert, we have discussion with the expert about the expression of the social distance. And then Dr. Tanaka chairs today and advised that the outreach of one arm. And later, there was the media report that the expert sustained the PCR usage. However, at this moment, what the expert were saying that, and it is very difficult to perform the PCR and not effective for to containment of this disease. And the environments are ready to facilitate the PCR. However, the PCR test, in which is the limited resources, it has to be focused on the patient who might suffer the severity of the diseases. And these opinions that we have expressed. And with Dr. Omi, I remember that I was writing this, and we were referring to the SARC issued by the US CDC and Crisis Emergency Risk Communication 6 principle. And 6 principle is be first. And don't wait until all information is ready. And be accurate and be sincere. And for those not known, and we need to communicate what's being done to elucidate the fact. And then we need to be credible and a credible source of information. And we have to express empathy. And if there are people's anxiety, we need to promote actions. And also we need to show respect in communicating with the general public. And this is the 6 pillars, which is very important, considered to be very important by CDC, and we'd like to hear your opinion, how you thought. However, we thought that we were able to provide the good principle at the time of crisis. However, once we issued it, that's not the end of the story, and we have noticed it. And then we were asked to communicate with the general public, and there was a time that we couldn't create the rules about the communication to the general public and also exchange at the media. So we used the media of our own, and also we have utilized the note, and we have had the meeting to be held with the general public. And when we warned the young people, and there was a hashtag that the expert meetings are blaming young people, and then when we proposed the new lifestyle, and then the expert were criticized that the general public will be reminded by the wartime, and in principle of one voice, and there was a criticism that the government working in silo, and then there are politicians and the expert are expressing their own opinions without the one voice. And there was the criticism toward the expert that they are too meddling. But however, there was not a good understanding that the public health itself is too meddling. And under this criticism, and we were sandwiched between many stakeholders, and some asking us that more detailed information are necessary, and there were heights of needs, and there was a request of having press conference every time we have a meeting, and then the excessive countermeasures are justified to be right, and then there was a criticism that meaningless countermeasures are invented and then spread as the important measures backed by the expert, and there was the opinions from the expert, from the municipalities, that without evidence of the expert, and that countermeasures cannot be released or relaxed. And we were the struggled to be involved in the conflict, bipolar conflict. So the discussion was that the infectious control disease or the social economic activity, even the experts were asked that which is necessary, and people were criticizing that the structure itself is not valid, and it is very difficult to communicate the structure itself is valid, and the general public was very difficult to understand that.
On the other hand, it was not only to disseminate, but it is important to listen to the others. So we had a feature to interpret it, what other people think. And I think what the Tokyo government did was something really critical. They have launched a risk communication team inside Tokyo no ICDC. So starting from July 2026, we were invited to the morning meeting, and we learned what people understood. And we also reflected on what we disseminate to the others. We also have been having a survey involving more than 10,000 people. Through that survey, we start to understand what the citizen in Tokyo is feeling. And we have been using Note so that we could again, disseminate that information to the resident in Tokyo. So by having this, while people are urgently looking for new information, we try to prevent prejudice and to happen. And I was also involved in the patient and public involvement and engagement. So we try to come up with a proposal to involve patient and the public to be involved in the R&D process. And listening to their voice is something important. So in UK, so they had a lot of victims coming up from COVID-19, and the medical situation was extremely negative. But what was really good was that during the clinical trial phase, they implemented controlled human infection model study. And through this process, they were able to conduct a lot of survey, listen to the voices of the people. I think it was something positive that we were able to see from the UK's case. And in Japan, the Japanese patient was under discrimination and prejudice. And we were able to reflect the voice into the R&D in Japan, which was regrettable. And this is something that I was interested in during the pandemic. So the information sharing was different from municipality to municipality in terms of the patient. So this is a diagram to show how each municipality have been disseminating information. So for Tokyo, they have been created a list in table. So they have a big population. So it might be difficult for them to come up with a concrete case. But in some municipality, they have traced the what the patient have done in the very day. And also, some municipality even came up with a diagram describing where the patient went, using what kind of communication method. So these were published to other public. This was really great for us in order to understand what was happening in Japan and the trend. However, the people tend to focus and blamed on who had brought the virus in their community. So it had triggered discriminatory behavior from some of the people through media. And some had to struggle under this circumstance. So last year we had a notification from the government saying that these are the information to be covered when next pandemic happens. So from now on, the name of the prefecture, manufacturer, the age range, sex, and the date of outcome is going to be open to the public. However, the government had also notified the others that underlying disease, occupation, municipality information, and nationality is not mandated for now on. And also, this information will not need consensus for the patient itself. That was written in the policy. So, why was this developed? It is that since new COVID-19 patients have been identified in Japan, and during the days when we had limited number of patients in Japan, if there's any benefit in terms of public health aspect, then individual information could be shared. So the government had issued this guideline. However, we have to also make sure that the information should be and limit to information which will not identify the individual. And also, this should be having a positive impact on preventing the pandemic. And at that time, transparency was one thing that the media was looking for. And also the local government members were also asked from the others, which led to leak of individual information. So we hope that this new notification should be reflected to the risk communication manual, and we hope that people will go under training. And this will be the last slide from me. So when I reflect the pandemic, there's three things that comes to my mind. So the first, people are reflecting and also redesigning the risk communication scheme. And having this new risk communication is something that we would like to see in the future. And in the risk communication, the expert's role will be should be more clear there, and we hope it should be improved. And also the place for the expert and the journalists to have a discussion should be there. And also in terms of the information share of the individual, we have to make sure that the rule will be promised. We don't want the individual information to be leaked, so that we could prevent discrimination to be prevented. And also, we would so some of the country had to make sure that is holding an event not to forget about the victims. So in UK, they have set a COVID-19 Day of Recollection on the first Sunday of March. And also in Canada, they have set March 11th for COVID-19 Day of Observance. And in Italy, they have decided to have March 18 to become a national holiday to commemorate the day. Armed vehicle had used to transport the bodies of the victims. So Japan has been not decided that these days, but we hope that we can come up with that. So that is all from me. Thank you. Yes, having this kind of meeting should be contributing for us to not forget about the dead. And since 2025, after March, I think people understand that we have go over the pandemic period. It is the day that we had been moved to Category 3. And so next will be Dr. Nara Yumiko.
Now, through the Dr. Murtaugh's the discussion, you have actually recalled what we have experienced. But the risk communication, what have we been pursuing? That is an intrinsic question. We've been starting to talk about the risk communication with the Dr. Nara and the Dr. Dr. Muto, we've been talking about this in a couple of years in the past, but considering their current experiences, you'll be able to understand what they are. So, Dr. Nara, in the past couple of decades, how are we coping the risk communication? Yeah, okay, let me just discuss. And another on Hoso University, and then I'm going to discuss the peacetime risk communication following the Dr. Mura's discussion. And as you can see in this risk communication, through our experiences from the COVID-19, it was really our hard experiences. But we need to convert them into our learnings and reflect upon our activities and countermeasures. And there are 3 points that we need to consider. Well, all of them are very important, but at the same time, let me just highlight the third one. That is my focus here in my presentation. And the third one, and then you cannot do things in normal times if you can't. It cannot be done in an emergency. So for the infectious disease communication, this is very important. This has been used in the past in case of the natural disaster or chemical terrorism. So, but the things that you cannot do in your normal times of peacetime, you won't be able to do it in an emergency. So it means that you have to be fully prepared during the peacetime or normal times, and otherwise you won't be able to go with the risks in case of the emergency. And as you can see, this is a slide I've been talking about, and then I am the researcher on risk communication based upon the COVID-19 experiences, and I now have reflected myself from these 8 points that the risk communication is really difficult, and especially depending upon the natural disaster or chemical terrorism or whatever. And we have got the various kind of measures we need to consider depending upon those 8 points. First one is that everyone was both susceptible to infection and responsible for infection control measures. And the second point is the pandemic occurred while stakeholders' foundational knowledge about infection disease was not necessarily sufficient. And the third one is that this necessitated risk communication regarding a high-risk uncertain event. And the fourth point is at the time of the infectious disease pandemic, and it is really a systemic risk that actually encompasses a various kind of field of the society. So risk-related communication must be communicated to the multiple organizations or the perspective of the society. And now we had the prejudice and the also the misinformation was the sixth, and disinformation has emerged in case of the infectious disease pandemic, and due to the internet prevalence that's been amplified. And the seventh is the measures that are needed to sustain behavioral changes among citizens. You know, the Japanese people and also Tokyo metropolitan, the residents, they really have to consider how to cope with the situation through their behaviors. And also the shortages in risk communication, personnel and systems, they become prominent, and so those are the things I have identified as the challenges of the risk communication through my experiences in the pandemic. We do not know when the next pandemic would come at end, but we need to mitigate those challenges as much as possible to be able to reduce the risks as much as possible. So then know what we can do based upon our learnings. Specifically, in one word, we need to be fully prepared in a peacetime. And for example, you can say for number one, what we can reflect from our learnings is as follows. In bracket number one, as you can see, you got to be ready. And you really have to capture the risk communication depending upon the attributes of the stakeholders. Because you need to disseminate the information, but you need to pick up the voices, and also you need to share the information, and you need to develop the times to be able to cope with the situation. And bracket number two is to cultivate the infection disease literacy in schools and in the offices to be able to improve their literacy about the infection management. And number three is you need to deliver the uncertainty in its presence, and you shouldn't be afraid of communicating that presence. And this is something that you have faced as a real challenge as an expert. So you have to be accustomed to deliver the presence of uncertainty. And bracket 4 is the systemic risk. You see the various kind of issues and the challenges existing at the same time, but it'll be very important to have the single united one voice. And together with the risk assessment organization or institution, they must be able to disseminate the consistent message that will actually earn the trust among the hearers or audience. And that is what is needed in peacetime. You need to work together with the stakeholders in order to smooth out the communication multidisciplinarily from the autonomous bodies, the governing bodies, and also society organization. And bracket number 5 is closely associated with Dr. Muta's point of view. I think peacetime preparation is very important, especially in order to avoid the discrimination or prejudice, because as the infection spreads, the discrimination and prejudice, they will actually hamper our countermeasure for the actual infections. And then the number 6 is the response to misinformation and disinformation, and that's got to be intervened by the experts and specialists who are to disseminate the accurate and precise information from the public bodies. So in order for that, we need to have the information literacy monitoring team and the infodemic insight team to be established, but at the same time, we must be the one to be trusted as the information dissemination institution. Then the other people must trust us to be able to find the consistent information. That is the reason why it is a prerequisite to build up the trustful relationship. And the bracket 7 is to foster the stakeholder partnership through the communication. And in the communique, as a partner with us, you need to closely engage with the population to be able to deliver the message. And bracket 8 is to establish risk communication system and to develop the talent. Those who are able to engage their communication, and those talents are needed, and also the risk. The communication principles should be developed, and manuals should be prepared, and also risk communication training, and also the communication experts should be established and positioned. And also you need to have the network to be able to receive the advice from the experts. And those are the things you need to prepare in peacetime, and especially the talents to be developed and must be fulfilled. And thanks to that, some of the companies were very successful because of the preparedness of those talents. In case of Taiwan, Korea, and Singapore, they were very successful, and they have the common ground. In the SARS or MERS, they have had the very hard time, and they have learned and then reflected upon the specific countermeasures in those Asian countries. And the countries like Switzerland or Netherlands, they have done the similar initiatives. And let's say that you can see the interactive communication has been started from the very beginning of the COVID-19 pandemic. And then the Netherlands initiative is something we need to closely look at about the countermeasure for the COVID-19 in Netherlands. And they have opened up the options they had to cope with the COVID-19, and they have started this initiative from the very beginning. It's called a PVE, means that the value evaluation through the participation by the population. And Delft, the engineering institute, has developed a platform to be able to pick up the voices of the people, and they have utilized it right away, starting from the April 2019, and already the 30,000 population has joined this PVV in order to be successful to alleviate their lockdown. So they have have been a harbinger, and they have been continuing this efforts as well. PB is really excellent because they have already been doing ahead of the COVID-19 pandemic, because the Netherlands is keen on the environmental issues and in order to deploy the countermeasures for the environment. That's the reason why they were able to customize and carry them across to the COVID-19. So the preparedness in peacetime is very important. And you can see that Taiwan was excellent and Hong Kong was excellent as the examples you can see. And the efforts by them have been shared with us, that we had an opportunity to be able to get the insights. And then I got the insights from the CDCs of these two countries with the perspective of the risk communication. And what I have learned was that they have the great insight of the SARS experiences, and they have reflected upon the countermeasures that have been built during the peacetime, and they have reinforced it through the talent development and also the system, and also they have already worked on the literacy enhancement of the population. And what they have done through the COVID-19 and is the one voice the communication, and also the variety of the communication and the tools have been used to reach out the population. And also since the COVID-19, they have had the media press conferences without having any time limitation in order to respond with some details to those press journalists, and also to respond to the anxiety of the population. And in order to capture the actual question, they have utilized the chatbots or social media questionnaire, and also they have utilized the media release as well, and they have conducted the survey as well in the early phase, and they have been continuing those initiatives and efforts now still. So we have learned quite a lot from the examples from Hong Kong and Taiwan. And the person in charge from these two countries was saying that there were two major difficulties they are still facing. Number one is misinformation, disinformation handling. That was really tricky, especially for the vaccine. Then it's exactly the same challenge we are seeing. And another one is the prejudice and discrimination, how to handle them. That was really tricky. And they are saying that the ultimate difficulty they are still having.
And of course, in Japan, like other Asian countries, have gone through the Mars and SARS and reflected the experiences into the policies. And Japan, our country, have learned from COVID-19, and we have to convert our learning to the concrete action plans. And this is what we have done. And this is one example. The government have created the action plan for the COVID-19. We have revisited it fundamentally. You may notice, and there are important points here. But the most important thing is the preparation at peacetime. And this is very important. So there are preparation time, initial time, and also response time. And we need to enrich the actions and preparation activities in the preparation period. And there are 6 items, and however, it was expanded to the 13 items to be ready. And information sharing and risk communication and information provision. And risk communication is now included in the item to be addressed. And this is the box for risk communication and for the information provision. And at the initial time of the COVID, the infectious diseases, and there are threat of the prejudice and discrimination, and also the misinformation and false information. And it's very important to do the two-way communication to share how we should observe and interpret the information. And it is very important to provide information from the peacetime, and then we need to facilitate the risk communication system and also the environment. And in risk communication page, and there are action plans for 3 stages. Definitely, however, how the risk communication should be treated and creating the environment are being emphasized here. In 2024 July, it was revised, and this year, the influenza action plan has been revised at prefecture levels, and Tokyo Metropolitan Office have revised it. And after the thorough discussion and deliberation, and in the point, and it says that the preparation at the preparatory stage is emphasized here. It is very important in the risk communication, and it has a fulfilling, enriching contents, and emphasizes that the two-way communication is very important. In the preparation period, it says that for Tokyo residents, if they want the information, and they go to the Tokyo Metropolitan Office website, and to do that, you need to, the Tokyo Metropolitan Office need to establish the trust among people. So we, through the COVID-19, we should convert learning to the concrete action plan, and when we cannot do it in peacetime, we will not. There's no way that we can do it in emergency time. So we need to create the system. We need to create the structure. 2023 September, and there was the GIS created in April 2025, and also the Cabinet Agency for Infectious Disease Crisis Management has established in September 2023. And in Tokyo office, there is Tokyo ICDC. In 2020, September 1st, the team has been established during the emergency, and this team has not been resolved even after the emergency situation has been settled. So this team is for peacetime and also emergency time. So it was a important role that ICDC played in peacetime and also the emergency time, and there will be a huge role that ICDC will have in the future. And public hearing and dialogue is the area that Tokyo ICDC is paying attention to, and we have done a lot. And including the group interview, we have done a lot of meeting to get the hearing, to receive the hearing from the residents, so that their feedback is going to be reflected into the policy, and we would like to do the effective public communication. And this is the last slide. Tokyo ICDC. Tokyo are doing a lot of initiative concretely about the risk communication, and our learning has actually been converted to the actual action plan, and then reflecting those into the countermeasures. And this is one good example. For example, in around this risk communication seminar is being held. I think it was the 3-meeting seminar has been held and chaired by Dr. Tanaka, and then I am providing the risk communication seminar. And this is how I think. Today, yesterday, and the 3rd ICDC forum is happening. In Tokyo ICDC forum is a great risk communication. Well, people can be connected and as a partner, and think about the infectious diseases, and then provide information and exchange opinions. And the contest was wonderful. Children take it as a own issue, and then put into the illustration thinking about the infectious diseases, and this is wonderful expression. So we hope that the Tokyo Metropolitan Office will continue this kind of efforts, and as a member of Tokyo ICDC, I'd like to contribute as much as I can. Thank you very much.
Thank you very much for your presentation. So, Dr. Nara, have been involved in the risk communication of Tokyo as a leader during the pandemic. So she was trying hard to listen to the voice of the resident and to reflect in the policy. And what people misunderstand easily is that the expert sometimes think that sending their voice is going to be a part of risk communication. However, just disseminating from the expert is actually a propaganda. But listening to the voices of the others and understanding that there is the existing service and then disseminating that information is considered to be a risk communication. So the contribution of Dr. Nara had a hugely positive influence. So I just want to know the others to understand. And also, the role of media is something really impactful in this pandemic era. And social media is strong in recent days. And I am studying in social media and mass media. And can social media replace the old media? I don't think so. And the person involved in the media may sometimes send out information which might be misleading or not accurate, but they are struggling to give accurate information. So now I would like to have Mr. Shinichi Kojima to talk about the lessons learned from the COVID-19 pandemic. Hi, everyone. So I was in TBS, a broadcasting company, and I was a journalist working in that broadcasting company. And I retired last year since I turned age to 59. And then I am currently in the university, and I am, again, I'm studying a new field. So the title for today's presentation is Lessons Learned from Walking Through the Front Lines of the COVID-19 Pandemic. So as a journalist, during the pandemic, so we walk around, and sometimes we wear a lot of shoes, and we are evaluated by the number of the worn shoes. And we try to look what is happening in the field, and we try to share that information to the listeners. That is the work that I have done. So I think since it was disclassified to Category 5, we rarely see pandemic-related information. However, pandemic is not over. I think you will understand about that. So the pandemic is not over. But what can we do under that situation? So journalists are considered that in daily manner. So these are the viewpoint that I have when I try to understand what is happening during the pandemic period. So first, hands-on principle. So while people were extremely concerned about a pandemic, people wanted to know what was happening in the hospitals and how the patients were struggling. So the treatment and how they were suffering were not communicated to the general public. And media to go into that kind of front line, is it okay? So stepping in without having nothing will expose that journalist to pandemic. But having a good negotiation in the beginning and talking with the doctors with PPEs on, then we can go into the field or the around the hospital bed. So we learned about PPE. We understood how to dress PPE multiple times. And then we were allowed to go into the room or the hospital. And that is not the only thing that we had to do. In that hospital, there are experts there. And we have to have a close tie, or otherwise they will not allow us to go in. Stepping in for the first time will not be welcome. But if you have a great tie, they will say that, Kojima-san had come and visit our hospital. And they will let you know, understand the information. And the media had to do and play a role on some part, but I'm not sure how much we were able to fulfill that. And I think through media, I think it might be our first time in Japan. I carried my video camera and went into the hospital bed, and the patient was struggling with breathing, but the patient was trying to communicate with the clinician. That patient was asking whether he or she could survive, and that was a little something that stuck into my mind. And I think I tried to understand the response of the audience in today's meeting. If people seem to be interested, I will try to deep dive. So, talking about hands-on, we often hear when the visitor restriction will be lifted. So, with the restriction, there we can reduce the risk, and it might be beneficial for the patient who are hospitalized. However, there are doctors and patient and their patient's family, and the conversation is needed among those people. But the bystanders, the general public, does not know what is happening there. So we were just asked to put on facial mask, and we were often asked whether we were okay to go into the hospital room only with the facial mask on. And I think this was something debatable in the future. And the next thing is about the point surveillance. So I tried to go to Okinawa. I called it mini Japan. Okinawa is an island surrounded by the ocean. So I tried to think Okinawa as a model, small model of Japan. And in Tokyo, at that time, we had several hundred journalists going around the hospital to gather information. They went to hospitals, governments, and municipalities to gather information. And in my experience, during the pandemic, is it possible for me to understand what is happening in Tokyo just by interviewing a limited personnel? I don't think so. So I tried to go to Okinawa to understand the behaviors and what the HCP do in Okinawa, because Okinawa had allowed to do so. And there was one expert. So I contacted Dr. Nakayama, and I followed him everywhere he went, from the morning to late at night, to see what he did. And there was many findings that I was able to get. So one, I would like to communicate you that the people in Okinawa did not think that we were false. The media are false. So taking precious time to talk with journalists was not easily done for most of the HCP. They have to read articles. They also have to see the patient. But they understood that it wasn't enough. So Dr. Takayama had cut his time for sleep, and he was having a learning session, study meeting, and he was doing consistently every day. And once the prefectural government official knew that information, and including all the other relevant official from a relevant institute, started to contact this doctor. They talked freely with the doctors. And I think this was one thing that stood up. And moving on to the 7th page, I only have 10 minutes to go. So, Dr. Takayama, so who was him? So, I think he was not understood completely. Some may be thinking critically. So, I chose Dr. Takayama because I thought that he was a commander in Okinawa. And I think Dr. Nara has commented about Taiwan and about the Singapore case. And I think there was a commander there. And in Japan, Prime Minister wasn't a commander. some thought by himself that he was a commander, but I don't think that it is a true commander. And this time, in terms of risk communication, we had to communicate thoroughly to the listener, and we have to lift the understanding level of the listener. That was critical. So if people's understanding is different based on their situation, so just having a discussion will not penetrate them. It will not lead to full understanding. It's not going to stick in the memory. So what the doctor did is to have all the information for doctors, for prefecture level, for the municipality. He had sent out all the information that he had to the listener. So the Okinawan was able to understand everything that the doctor knew. And they were able to understand the role of the doctor.
And you know that in order to have everybody understand what they don't understand, it is the highest form of the communication and the most important thing. And in that sense, the commander in charge was really the excellent. Whenever he had time, he was input the information upon the personal computer and he shared. And also he built up the line group and where he would share all of the information with the group on the social SNS, and also, if necessary, he would talk to the actual janitor of the nursing care home in order to hear the direct voices in the field. That's what he has done. And I've got the 8 minutes and a half, so let me just go around once again. Yoshihiro Takayama did the things as follows. Before he graduated from the medical school, yet another in the university, he was learning in the public health. He was learning public health major. That was one of his strengths before he got into the practice. And let's say the biostatistics and the experts in the Hokkaido University and have been invited to his team. He made them as a part of the team members. And infectious diseases are not visible, and you do not know how the trend would evolve and how the virus would behave. So you need to show them from the biostatistical point of view, and that's his perspective. That's the reason why he has gathered those expertise and incorporate them into their team Okinawa, but that was highly effective. Of course, the biostatistics might not be always right at the point, but there was no wide away from the reality. And also, this is the evidence beyond the discussion. As you can see, those mild patients should stay at home to recuperate. And a lot of media outlets have sent out this message, but that was not well communicated through to the field. You are fighting against something invisible, right? But how you can cope with it? You really have to have the video clip which can tell them how hands-on, as you can see. And Dr. Kaku there, he took time out of his very busy schedule in order to prepare this kind of video footage. And it's on YouTube channel, so you'll be able to watch it. So those mild patients have to be nursed at home, and within the family, you may spread the infection to your family members and what to do with it. This is the handbook prepared for the citizens. You can see the infection control, the expert is explaining how specifically. And today we invite Dr. Kaku, and we are assuming that the pediatric patients in your family. And can you tell me how to handle with the situation within the family household? These are the things you need to pay attention to. And you can see this is the household for shooting. And I guess the patient must be segregated, right? If the patient is symptomatic versus their family members who are not symptomatic, they have to segregate their rooms. And especially the patient, when they are recuperating, their ventilation must be good enough. So maybe 5 up to 10 minutes windows have to be opened at every 1 or 2 hours in order to ventilate, in order to trim down the words count in the room of the patient, in order to reduce down the risks. So what the family members will have to be careful about, can you tell me? Well, even their kids must wear their mask, and also the caregivers in the family, they have to wear the mask and also the mask as well. So as much as possible, you should limit one person to take care of the patient so as not to spread the disease. And then you're going to take care of this pediatric patient, right, with the gloves and the mask on. And on the surface of the gloves, you see the viruses are actually there, present. So you really shouldn't touch the glove with your bare hand. So you got to take it out, reverse end. And now you should take it off from inside of the glove and reverse it so as not to touch the surface because there's a virus. And you need to put it in a bin. And if you have the tissue paper used by the patient, that's got to be thrown into this kind of vinyl sack, and you need to tie it up like this. So those are the things. And you have seen just a part of the educational video clip, but over 3 days, approximately 150,000 people have watched to learn how to handle the household patients, and then we had quite a lot of repercussion, as you can see, and then the brochures wouldn't tell everything, and this video clip could tell these detailed things you couldn't find in the brochure or the pamphlet, and that was really helpful, and that's the feedbacks we have got from quite many viewers. And I'm going back to the Okinawa example. Once again, let's say due to their cluster onset, let's say the nursing homes, they have been in a fast and they've been really in a messy situation, and also in the aquarium or resort hotels. There are many of them in Okinawa, and when they identify the cluster onset, they're always the commander-in-chief, which is the Dr. Takamaya, visited there in order to check the zonings, in order to check the ventilation, and also in order to check the PPE and how to wear and how to take it off, and you were not able to learn just at one training, so he's repeated it. And as you know, in case of PPE wearing, it's quite a deal to take it off, and then almost all the time people would get infected when they get it off, so because they feel somehow relax, but if you just mess it up, this getting off the PPE, that'll be a problem, and unless you experience it, you won't be able to learn. And I have actually captured those their training, and I gave the video clip to those nursing homes, and they'll be able to check how to do the undress in the PPE, and then if you repeatedly watch them, you'll be able to learn how effective the PPE is. And once the Dr. Takama is called to any of the places, he would have visited 2 or 3 times a day at those nursing homes or the sites in order to tell the specific ways to zoning or ventilation in order to prevent the infection from spreading. And now that I have got only 30 seconds to go, so let me just be brief. Lastly, you can see the Japanese government, what they have done. You see the Prime Minister Abe, former Abe, and he have actually distributed the Abe mask, and then he has actually they closed down their schools, but he probably took up the light of the specialty and expert. Tokyo 2020 could have been postponed, and but the. And at that time, he and his government thought that the pandemic is not going to be so long. So it seems like that the government-led initiative has been united leader put through. That's my personal point of view. And also the former Prime Minister Suga-san. And I guess, every day we could see what kind of actions the Prime Minister have taken the day on the newspaper outlets. And you'll be able to see what kind of appointment he has got. But you can see, and he has sought for the specialist point of view from various kind of field. I can appreciate his attitude, but at that time, under the circumstances, he announced go to travel to encourage the traveling, and he made a decision in order to prioritize the economic circles, but that didn't get the consensus among the population. And Kishida-san, and he has got the very few explanation, and also had the discussion with the expertise, and the expertise have complained to him. And in the latter part of his tenure, he has been engrossed into the Ukraine and the conflicts, and also the price. The hike and the defense economy. That's the reason why his priority was lower. And so these three former prime ministers, especially in case of the former Prime Minister Suga-san, and he actually retired from his position. That was a good opportunity and a good thing. And I have done the long interview with Suga-san, and I actually asked her what had happened at that time. And Abe's son passed away, so I was able to get the feedbacks of those days from Suga-san. And because the governmental decision is in a black box, so we do not know the rationales behind. But unless you know, we are not able to have the next countermeasure based upon the learning in the black box. In order to clarify that, together with Dr. Muto and Dr. Nara, and we would like to move forward. So sorry for running over time by 2.5 minutes, but that is all from me, Kojima.
Dr. Kojima, thank you very much. We have 20 minutes for discussion, and we will make the discussion open to the floor, and we would like to ask Professor Kosaka to facilitate the meeting. I think there are many people who are involved in the infectious control, so you may have a lot of opinions, and there are experts of the risk communication, Professor Nara and also the Professor Muto, and we can rely on them. But that's not the case. And when we look at the circle members of the CDC, right message at the right timing, that the right person, right spokesperson, at the right timing, right spokesperson, communicating the right contents to a right spokesperson. By doing so, we can save a lot of people. And this risk communication can be effective more than vaccination. In Hong Kong, and vaccine risk communication didn't work well, and then the elderly didn't get the vaccinated, and then there were a lot of deaths in the elderly population. And there are risk communication experts in CDC. However, in U.S., when we are in a case that when the communication is very has to happen, like the manager above, and they have to be qualified as the risk communicator, and the angle of the glasses and facial expression, they have to learn into that detail, and that is the proof that the U.S. thinks that the risk communication is very important, that the guide name is that survivor guide. So risk communication is considered very important. So I experienced the Hong Kong outbreak, and I met the 4 CDC expert from US. And there are trainees, always one trainees, and 1 out of 4 were the expert in the media response. And there are 10,000 in the CDC. I don't know what would happen under the Trump administration, but 10% are the media response expert. So those 10% of the CDC staff are communicating with the media staff and also establishing the good trust with the media circles. So Professor Nara said that the communication in peacetime is critical, and Tokyo has the ICDC, and ICDC is communicating with lots of stakeholders, and Tokyo, the Metropolitan Office, and play the role of leaders, and hope there is doctors from the GIS. So we hope that this can be reproduced in other prefectures. And COVID-19 infodemic and misinformation spread earlier than virus, and nobody knew how to respond and address this situation, even after the series of meetings. So AI can create the movie, video, and that contains the false information, and that could spread quickly. And we have an expert like Dr. Tanaka. We'd like to discuss how we could deal with this situation. So Dr. Tanaka, please share the expert opinion. Thank you very much. Main job is the risk communication and mass media and social media, and how the risk communication is being conducted, and how the general public is formulating the risk image based on the information provided. And Professor Nara talked about the importance of the risk communication. That is a direction we're heading towards as Japan. But there is an issue big issue when we think about COVID-19. As you know, there is an infodemic. Word infodemic, miscommunication, false information. I think mass media was aware of it. However, the SNS spread the miscommunication rather. In 2020, and we were turned into the with Corona era in 2020. And you may have forget 2023-7. And in July, the Twitter was turned to X, and earning money by instigating the battle and controversial discussion, and they can earn money. So they have changed the policies, and people will be confused. And if you're attached to the social media, exposed to the misinformation, and talking about the vaccine is not good, vaccines is good, and what expert, and let the faction fight pro-vaccine and post-vaccine, and there's no concealment there when the Twitter is turned to the X. So I think that the government do not know yet how to respond to this confused situation. So, like Dr. Kojima said, mass media, all media, I don't know if they are involved in the miscommunication spread. However, as Dr. Muto, Professor Muto and Professor Nara said earlier, how the expert and an administrative body can be positioned as a trustworthy parties. So Tokyo Metropolitan Office, Tokyo Prefecture, has the data dashboard working with the programmer. And whenever the Governor Koike announce the policy, they are putting information of the website that what are the background and reason why the government, Governor Koike, have made the decision of that policy. And there is the prediction and forecast that they can learn from the website information. So those Tokyo residents who are interested in the Tokyo policy, they are looking at the data. And they are picking up the points and issues of interest. And I became aware, looking at the group interview, that many citizens are aware of what being disclosed on the website. So rather than people who are shouting that disinformation is false, but many residents are relying on the information that is revealed by the Tokyo Metropolitan Office. So if there are any additional information, please say so. And there are different opinions among experts, and there are conflicts even among the experts. How should we deal with that? In Tokyo Prefecture, I remember that the Vice Governor Miyasaka-san, and how website should be promoted as the common media among the familiar media among the Tokyo residents. And he had the thorough discussion with the stakeholders. It's a wonderful initiative. And they have run the questionnaire of the 10,000, and they have the resident monitor system to collect the feedback, and the residents will be involved in the policy making and decision making. So, Professor Muto, what do you think? And Professor Nara and Kojima-san, what do you think? When right before I think it was the sensitive timing that I think with the AI advancement, the expert is standing and dancing with a bikini created by the creator as the false image. But we were not there yet when the COVID-19 was spread. And many people are talking to the generative AI to get the answer. And Dr. Tanaka was talking about the platform industry. So we have to question the ethics of the companies who are producing the dialogue-based and generative AI. So we need to watch the policy and ethics that those companies has. Generative AI impact is the area that I have concerns. So when we think about the infection disease, of course, that's not the area we should only focus. I think we need to raise awareness from the peacetime about the possibility of misinformation spread. And I will say it again, there are a lot of delusion of the information, and this Tokyo Metropolitan Office and the national government has to be positioned as the primary source of information. That's something achievable. And this is something I talked in a different occasion. However, that when we think about the risk communication and trust, that always has to be combined. So there are things that we need to clarify, three things, and differentiate it. And the trust to risk information, and that is issue with the capability of the generative AI, and also the trust to the people who communicate the risk information, and also the trust toward the risk communication itself.
I think that trust to risk communication is something extremely crucial, and I think there's some part that we can play in. So, how the citizen or the Japanese nationality start to trust is, I think, the response, the timing of information dissemination, and also whether having option for the listener to come in and have their voice heard is one thing. Also, after sharing the voice, whether it's going to be reflected to the policy of Tokyo. is one of the things which is important. And if it's not reflected, then maybe a message saying that it cannot be done because of the budget discretion, personnel discretion, or so on. But maybe giving a necessary rationale to that will be important so that people could start to have a trust on risk communication from the government. So the people will start thinking that the risk communication information from this hospital could be trusted. And the information sent out from that specific individual could be trusted. So our first choice to become the source of information is one thing, and it cannot be done in one day. So it has to have a transparent and also and a lot of effort has to be made, and it has to be starting from peacetime. Then eventually people will seek the information in the pandemic or urgent situation. And I think Tokyo has been done quite well at this moment. Okay, I think you talk about increasing media literacy. And I think the government or the public institution can also give out limited information. And if we are going to give out other information, the other organization might be very good at it. And I think misinformation is something really attractive for the listener. And generally, information sent out from governments or local government is not appealing. So considering that, what can we do? So the knowledge level, the people who has large knowledge level might be seeking for that. This might be something different from U.S. So my question here is how to go around this issue. If you have any good opinion, please share with us. Yes, I think the education is something extremely important in this. Also, depending on the topic, I don't believe that people will go to single source, just considering about the interest. If there might be other reason for them to select certain resources. So education and discussion is something which needed to be in the daily setting. And I think Tanaka-san, Dr. Tanaka might be more knowledgeable about that. So can I have a word to you? Yes. Okay. So I would like to have Dr. Tanaka to begin, and then I'm going to take the latter part. Maybe this might not be a good response to that, to your answer. However, to the target, whether that person is communicating the right information is something that we have to have a good look on. So the disseminator might be sending out information, but sometimes the public will not refer to that information. So first we have to make clear what the people are seeking for. And then after that, we have to have the public to attract by giving out relevant information. That's one thing. And the second point, talking about communication, as I said before, so there are many people trying to take a communication. So we have to be in the same shoes and have a same understanding before having a discussion. So when we start to talk to the public, we have to understand how they see this topic. So we have to understand that. So we have to make sure that we have the common understanding in the beginning. Okay, Dr. Tanaka, can you give the final comment? I don't know this will be the final comment that you expect, but as you said, I'm aligned with the hands-on and dialogue, which Mr. Kojima has just said. And I think dialogue is something extremely important to begin with. So we had an event on having a discussion with the government and the resident in Tokyo. And there was some opponent in that group. And in that meeting, that anti-vaccine personnel tried to give out information so that he could be understood. And the others, the listener, understand that this person is opposing vaccine. They understand. So there was a respect, and they were having respect during a discussion. And this is a part that you cannot feel on social media. So communication starts from dialogue. And how we're going to involve in the policy making is one thing that we have to consider on, and it takes time. But having discussion, dialogue, certainly something needed. And I think some presenter had commented about generative AI. So let me talk about that. So the generative AI in Japan might proceed slower than the other country. So misinformation to be feeded and how it's going to impact on the outcome is the study that we are going to do. And there's some program that make us understand that process. And during that study, comparing English and Japanese, we found out that generative AI is not strong in Japan because the base language is made in English. And in English-speaking language, there's racism, hate speech, or vaccine-related information has been accumulated in their database. However, in Japan, we had avoided to have some discussion. So there's no necessary training or the feeding information in the beginning, which is leading for us to lag. So if it starts to learn, so the generative AI will say, I'm not sure how much vaccine is going to have a positive effect. That might be the answer that the generative AI will come up with. So the answer from the generative AI differs from English and Japanese. And so how are we going to respond to that? So as the other said, we have to accumulate accurate information in order to respond to that. So sorry. This is the challenge for the future. It might be negative, but this is the response to your question. Yes, I thought it was really interesting on what you have just said. So the goal, it's the kid had died, and after that, they tried to give out information, a message, a message. With billions of people around the world. And when he asked what they want to do to the generative AI, is there anything that you would like to comment on, Dr. Tanaka? Yes, I think we shouldn't leave everything to generative AI. That's the first thing. So literacy is owned by us, and by youth. So you shouldn't leave it to generative AI on what you think or your consider or your thoughts. So generative AI is just learning the pattern of the thoughts. So you can't ask generative AI to make a decision. So yes, I'm collecting information. Generative AI might be beneficial. However, you should not give up yourself. You shouldn't respond to the instruction of yourself. If you listen to what generative AI say, maybe people will commit suicide. So yes, again, you shouldn't leave it to generative AI.
Oh, the time is running over quite much, but if there are no comments, I would like to wrap up this Roundtable 2. Thank you very much for your insightful contribution. Thank you. And once again, Dr. Tanaka, Dr. Hosaka, Dr. Muto, Dr. Kojima, thank you very much indeed for your contribution to this Roundtable 2. And with that, risk communication Roundtable 2 is just finished.